You know, when you're like hanging out with your friends, doing your stretches or whatever, and none of your friends have faces or fully opaque legs, we're starting to understand more about the pelvic floor or the pelvic diaphragm. I'm going to be using those two interchangeably here, so if I use one or the other, know that they're essentially the same thing. We're starting to understand that the pelvic floor, this muscle located right at the bottom of the pelvis, has a lot to do not only with movement, but as well bowel and bladder health, as well as sexual health too. And I just want to make a point. I know a few pelvic floor specialists, physiotherapists who've trained in that, and they'll say men tend to avoid this type of work, even though they very much need it, even though it can be very beneficial for them. It's really something to think about, because there's no reason to be embarrassed about this kind of thing. It's totally normal. Now, I have to say, I'm not saying you should do this particular stretch I'm about to outline here. It's always good to consult someone who really knows when this is appropriate, but when it's the right thing to do. The mechanics of it are actually fairly straightforward, and it can really help addressing this area in particular. So when you squat, when we're in this position, call it whatever you will. When you squat, if you look at the angles of the femur, they're coming out and to the side this way. This is actually a good angle. This is not easy to get into, if we're all being honest, depending on how old you are. But it changes the pull on the pelvis. And that's really what we're going for. Just going to a little bit more of a faded view here. You'll notice that the hamstring muscles attach from the ischial tuberosities. I'm just going to draw one side at first. And they go all the way, we'll say, into the knee, really like the tibia fibula area. But because they are angled out now, because they're pulling in this direction, it exerts a force, a lateral word force, on those ischial tuberosities. We could say the same thing to a lesser extent, but we could say the same thing about the adductor muscles. They're going to be pulling on femur, from femur to the pubic symphysis, more in the front. That's that part in the front. And just to show it just slightly differently, this would be the pelvis from the bottom. This is the pelvis from the front, a little bigger than the other pictures, pelvis from the very bottom. So those ischial tuberosities we're talking about, it's right about there. So it's pulling out that way. And then when we talk about the adductors, this would be bilateral. This would be on both sides, of course. The adductors would be pulling out a little more that way. So we're getting a general, if we do this right, we're getting a general little bit of a separation of this. It's not a harsh one. It's totally sustainable, but it's creating a little bit of a lengthening or a separation of this area. And this can be beneficial if done well. Now, not only that, more than that, we actually have the weight and the pressure of the body essentially being exerted downwards like that, the weight and the pressure of the body. Because if you consider the position, so just looking at it from more of a lateral view, the weight of the body, some of it's forward as drawn here, not always, some people do it slightly differently, but because of the body's position, the pressure of the upper body is going to be pushing straight down, and we've essentially got a stacked system, if you will. We've got the head pushing down on the thorax. The thorax has a respiratory diaphragm we'll get into in a second. And then we've got all these guts in here, and those then press on the lowest part, pelvic diaphragm. Really simple way of explaining it. So by holding this position, by getting into this position really at all, we're creating a lateral word pressure, a pull even. Really, a pull's a better name for it. Lateral pull. Way too big, I've drawn it here. And then a descending type of pressure to start to load it, to start to bring those ischia and that pubic symphysis a little bit apart. It's strong enough to take it for sure, but by holding this gently for a long period of time, you might get what's called myofascial release of this pelvic diaphragm, this pelvic floor here. And because it's a muscle that can become too tense or over contracted, if we get a little bit of separation, a little bit of lengthen, it can be very beneficial, especially to the things that pass through it. So not a bad idea. Now, what's more than that? This gets interesting. We can start to augment this. Again, because we are in this position, because we're loading multiple points. Head on top of thorax, on top of abdominal region. we can start to change the pressures in this system quite easily by a very simple thing. So the guts, for instance, actually, let me draw that pelvic diaphragm back in here first. Pelvic diaphragm would be give or take right about there. And it has the capacity to move up and down and up. It does that kind of thing. But we're just going to draw it nice and flat for now. Understand that all of the pelvic organs are sitting right on top of that. And that's going to be the bladder and we'll say the uterus. And of course, the rectum will be coming down somewhere in or around there. They'll be sitting on top of that. There'll be a little bit of a tissue over that. I think I've drawn this too big. A little bit of a tissue over that. And then above that, I like to do it in blue, is the peritoneum. That's all the other organs that we often hear about. And that's like our small intestine coming around that way. It's the liver there in orange. There's a few others. There's the spleen and the gallbladder, pancreas too. But covering the very top of that is actually what we call the respiratory diaphragm. We have a pelvic diaphragm down here. We have a respiratory diaphragm up here. And that is your breathing muscle. The main one anyways. Not the only, but it's the main one. And so what that can do, this gets real cool, as you breathe in, that respiratory diaphragm descends. It pushes down on the abdominal organs. And then that in turn pushes down on the pelvic organs, which pushes down on the pelvic diaphragm, the pelvic floor. So it's a continuous thing. It's not a harsh pressure. It's one that's designed to take, 10 to 18 times a minute every single day of your life. So it's completely fine. But as we get into this loaded position, as we start to stack up these pressures on top of it, we can really start to augment the type of pressure that's occurring at that pelvic diaphragm. You may find it's actually harder for you to breathe in this position. That's perfectly reasonable. It can be awkward at the start, but it's because we're loading up our tissues very, very differently. It turns out, too, that the respiratory diaphragm, our breathing muscle, again, tends to descend along with the pelvic diaphragm. That upward and downward motion of the pelvic diaphragm, so when it drops down, it's usually on a breath in. So as the respiratory diaphragm does this, pelvic diaphragm does the same thing. So they're kind of paired in motion. It would make sense that we can augment this position, this lengthening of the tissue through those means. Now certainly it's not a cure-all, doesn't fix everything. Oftentimes you need professional help with issues down there, but this is a good start. It's a good way of addressing things. It's nice and safe. It's nice in general.